Hey guys, today we're talking about a pinched nerve. Have you ever heard someone say that they've pinched a nerve, Dr. David?
I definitely heard of a lot of people say that they've pinched.
I thought you might have said that.
Yeah, so a classic example, this is a sciatica type pain. So a pinched nerve can occur in, for example, your lower back. It can be also occur in your neck as well. So what that means is that people experience pain in their peripherals. Usually they would complain about shooting pain or radiating pain down their limbs, and that can actually originate from a nerve root which originate from their spine.
Absolutely. So as Dr. David has described there, we have a pinched nerve in our neck, have a pinched nerve in our back, and people will complain of what we call radicular symptoms, and that can be anything from numbness in the patch of skin that nerve supplies. It may also present as a muscle weakness because nerves supply muscles as well. So it can affect our feeling in terms of cold or heat or itchiness, or a lot of people say burning type pain or shooting pain. Or we might result in a weaker muscle in the foot or the hand, for example. And that's precisely what we do to test if you've got a pinched nerve. We have a look at some of the symptomatic presentations. We might test some skin sensory perception. We might test a lot of different muscles. And in fact, that's what we do a lot in here. We test a lot of different muscles to see how the muscles have been affected by the nerve, or to see how the pain sensation or the touch sensation has been affected by the nerve.
100%, Dr. Jeremy.
Yeah.
So some reasons or some causes that may cause a pinched nerve, it could be originate from a chemical origin, for example, a bit of inflammation. Okay, it could be a mechanical origin, so for example, a degeneration, a disc irritation, and things like that.
Absolutely.
Yeah. So can chiropractic help with this, Dr. Jeremy?
Yeah, well, that's just like what you were saying before. People will often say that it's irritated by a disc, for example. Like we have a disc irritation, we can see that sometimes a disc bulge will irritate the nerve. Now, we can't magically get rid of that disc bulge, but what we can do is have a look at your body, and we can help manage a lot of these nerve irritations by, if it's a mechanical origin, which is a physical torsioning or irritation on that nerve from the spine being out of balance. Sometimes if we get all the ligaments, the tendons and the muscles working a lot better, we take a lot of irritation from that disc and that nerve. If the whole body is much more structurally stable, the body gets a lot of more chance to heal around that disc. And sometimes that can be enough to take away that nerve irritation. Sometimes these have gone too far, and we may need to obviously refer if that's the case. But they're the tests that we do to work out if we can help with an irritated nerve or a pinched nerve. And absolutely, there's a lot of research to suggest that chiropractic care can absolutely help manage a lot of these symptoms, so that we don't have to go and get that more invasive care. Like we don't have to go and get lots of pain medication. We don't have to go down that surgical route if it's not necessary. So we always, yes, Dr. Dale, we always want to try conservative care first. This is precisely what we're doing here.
100%. So yeah, if you have any family members or yourself have a pinched nerve or suffering from any kind of pain in their joints, in their muscles, come talk to one of us and see whether we can help manage your concerns. Otherwise, we'll see you next week.
See you guys. Thank you.